Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look into the heart sounds. So in case of heart sounds, there is S1, S2, S3 and S4. So what happens in case of S1? The S1, the frequency is about 25 to 45. So 25 to 45 is the hertz is the frequency. And how is the duration? The duration it lasts for 0.15 seconds. So 0.15 seconds will be the duration. So what are the associated events? It is the closure of the AV valve and the onset of the ventricular systole. So closure of the AV valve, and also the onset of the ventricular systole, Then we have the ECG correlation. ECG correlation is later half of the R wave. It is the later half of the R wave. Next what we have is the S2. So S2, the frequency is about 50 hertz and the duration is slightly lesser than the S1. So here it is about 0.12 seconds. So in case of S1, there is a closure of the AV valve and the onset of the ventricular systole. And in case of the S2, there is a closure of the semilunar valve. So closure of the semilunar valve and also the onset of the ventricular diastole. So onset of the ventricular diastole. Next, what is the ECG correlation? So in case of S1, it is the later half of the R wave, and in case of ECG of the S2, it is the later half of the T wave. So R and T. So later half of the T wave. Next is we move on to the S3. So what is this S3? S3 is where the frequency is very low. The duration is about 0.1 seconds is the duration. And the associated event is the first rapid filling phase of the ventricular diastole. So there is a rapid filling phase of the ventricular diastole. And this is rapid filling phase of the ventricular diastole. So the ECG correlation is it is between the T and the P wave. So T P wave. So between the T and the P wave is where this S3 it occurs. So S1 it occurred in the later half of R wave, then S2 it occurred in the later half of T wave, then S3 it is between the T and the P wave. Now we look at the heart sound of S4. So in case of S4, it is below the 20 hertz. Below 20 hertz. Below 20 hertz, the duration is about 0.1 seconds. Is the 20 hertz. Then the associated event. The associated event is it last rapid filling phase. There is a last rapid filling phase of ventricular diastole. This is due to the atrial contraction. So in S3, what we saw was it is the rapid filling phase of the ventricular diastole. Here, again, it is a rapid filling phase of the ventricular diastole, and this is due to the atrial contraction. So S4 is mainly due to the atrial contraction. Then what is the ECG correlation here? ECG correlation is it is following the P wave. To learn and grow daily like this, please do subscribe.